Hi, welcome to the 3-minute neck pain when should I come in video. I'm Dr. David Warwick, your local Lacey Olympia chiropractor. You know, neck pain is the most common complaint that we hear of, or at least second to low back pain. Second to low back pain. And neck pain can affect some of us at one time or another in our life, whether it's chronic or a permanent type problem. It's when it starts affecting our activities and our quality of life. You need to look at that and evaluate when it's time to get the treatment. So here's just a few tips to understanding of when should you come in when you're experiencing, whether it's neck or back, but in this situations we're referencing a neck pain and stiffness. That's the two most common symptoms we'll hear about from people, and that's where you'll feel pain in the middle of the neck or on the sides of the neck, all the way into the shoulders. This, can contribute to causing, tension type headaches, and you may experience some things such as difficulty turning your head to check a blind spot, even resting, where your head's in a static position, or even simply reading a book. While it's not life-threatening or serious, it does affect your life. If you wake up one morning and all of a sudden your neck is, what we hear from people call the kink in it, that is a type of torticollis or wry neck. Usually if you don't wait it out, this can resolve fairly quickly when you come in to see a chiropractor. These kind of things such as torticollis can occur when you're exposed to like an open window type of draft, weather changes, trauma, cold, flus, those kind of things, and it's always better to be safe than sorry. Numbness, tingling, you can experience that in your face, arms, hands, fingers, and the best essentially the primary cause of that is a pinched nerve in the neck, and the nerve root that's coming out may have different symptoms of numbness or tingling or electrical type pain that people often describe. And other common symptoms that may go along with it is if people feel clicking, crunching, or a grinding noise. We call this crepitus in the neck, and it's a type of early formation or of arthritis in the neck as it's starting to build up, being out of so to speak, out of place. This will often radiate into your arms or into the shoulders, and can, especially if it's not addressed quickly enough, can result in even worsening of some of the symptoms where it becomes more debilitating. The third type of symptom or things to look at is dizziness. This can result from neck problems associated with like movement, whether you're lying or sitting or going from one or the other position. It brings on a type of imbalance or a spinning or a dizziness, like some of my patients call it like a whirligig almost. Sometimes it can be caused by stones in the inner ear that's shifting. We call it BPPV, benign paroxysmal positional vertigo. And this can be, often addressed when it's managed early on with specific exercises for BPPV. And this will, and another thing to look for with the dizziness is when there's restriction of blood flow, and that's usually to the brain. And, obviously in these cases, when you're experiencing this, prompt response will get you the, before things get worse. The other thing to consider is if your sleep is ever becoming interrupted or you're having difficulty falling asleep, you may experience some tiredness or irritability. Jokingly, I share with patients, hey, if the hubby needs a attitude adjustment, absolutely can definitely affect, when there's areas that are misaligned in the spine, not helping you to feel your best. And usually, and most, the big thing to remember is when you have prompt care, usually results in prompt resolution. So I'm Dr. David Warwick of Warwick Chiropractic. Visit my website at drdavidwarwick.com. You can visit my blogs. Give our office a call at 360-951-4504. You can also, request to see or download my book, back and neck pain relief, short-term care for your back and neck pain, and not one single visit more. Thank you for watching.